Sorkar TV. Ka undi basnyam bat penjasliang. Rupa Premium Meghalaya.
Menteri Kekaya Jongga Sorkar Jylla ba waila miki Jylla. Ule thu baka Sorkar kan sedang ke Mishon kebasan Snem da ke babo bon Tylli Jaka ban letas. Hakalengga Jylla baka Sorkar Jylla kan mangpisah kumba arpusan kelurtam na ke benta ke Jaka sumar bagi Jaka ban tes yaki brio kiba subai ladi biklangat hok nyang jingpang HIV. Jaka ni, Menteri Kekaya ulapan pau habakaran haga jingraki ke World AIDS Day Hasti Convention Center belapan long dengan bagi Lai AIDS Control Society bat kathanan Kekaya ke syitri kuna pra arhajar arpusan. Haga ni kesngi lai don lang ki MLA bikin thop uba Edelbert Nongrum uba Olen Sing Sun uba Matthew B Kurba u Principal Secretary kathanan Kekaya Usampat Kumar ki doktor ki samla bat kiwe.
As you all aware, we have about 9,000 people living with HIV, and the more than 3,000, like 99, are from East Khasi Hills, and around 3,000 plus from West Jaintia Hills, and another 2,000 plus from East Jaintia Hills. So basically, these are the high burden districts, we can say. So we have, and every year we are also getting about 900 plus people living with HIV are tested newly. So here again, someone would say that, like, why new cases are coming, because there is a proactive approach for detection, because we should not feel shy, and we should not actually show any stigma around this one, because this is something that is a very, very important thing, as Kong has very rightly said. It is something that you should not have any fear. You should actually come and see, like, if there is any, if there is a injectable user are there, they have more probability. Almost like 30% of our people living with HIV are the substance users. So they definitely, there is a danger is there. I think you need to definitely go and get tested. If there is any time, if there is anything has happened. Similarly, people with unprotected sex are especially with with multiple partners, this is again very important thing that one has to really go and get tested. I'll give one case. This has happened in East Jaintia Hills, Pamra Paitlu. There is one medical officer who went nearby high school, and he told about the importance of HIV testing, and how actually one can prevent from any dangers. And after the session, 5 boys came to visited his PHC asking for testing, saying that, like, we were not aware, like, something is we wanted to be assured that, like, nothing has happened to us. So that means, like, basically what we're also telling, in fact, from health department, we have asked all the medical officers to do like this. Every medical officer not only should visit the nearby high schools. In fact, even the high schools also can proactively ask for the medical officers to come and take a session, so that like more and more education will happen. Because as per National Family Health Survey, which happens every 5 years, only 16 to 17% of the people are aware of HIV. That itself shows that, like, in rural areas, in a lot of places, the awareness is lacking seriously. So we have to, as a mission mode, as in fact told by our project director with various meetings that what we had with our honorable chief minister, and also honorable deputy chief minister Bapri Stone, and also our honorable health minister. What we are trying to do is that we're designing a mission mode program to really bring this awareness and to see that, like, we prevent this, the disease, so that, like, people will be aware, and they actually, will go for proactive testing and save themselves, and also, especially to stop the further spread of this disease in the state. So that is the idea behind it. So this day that we are celebrating is very important, and we really look at the young people, the students, as an ambassadors to take this message to the rest of the communities, because you understand the science, you study science, so it's so important that, like, learn about this entire thing, how actually this can be prevented. So, and we really make Meghalaya as AIDS free. And very soon, maybe our goal should be, like, in next 5 years, we should see that, like, no new cases actually are coming from the state.
As you know, this year theme is overcoming disruption, transforming the AIDS response. Remind us the progress is only possible when we confront challenges with unity, courage, and innovation. I still remember when I took in as a health minister. At the same week, the member from the MAX, on the leadership of the project director, came to meet me and presented all the efforts taken by MAX. But I was so surprised that instead of so many efforts, my only question for them that day was that why, after so much of effort, that the number of HIV is still increasing. That's what we will discuss that day. And I told them, I think not only me, but everyone saw the efforts made by them. Everywhere you will go nowadays, you will see Max is there with their team, expecting people to come and test, giving awareness. But I told them that maybe we are not able to put the effort in the right way. And as already mentioned, already shared by the president of the MSNP and his missus, that having an HIV is not only a challenge faced only being infected, but to face the stigma. That is the biggest challenge. So that's why I feel that, and on that particular day, I told the project director also that why people are not coming forward to test, and why people after coming also, why they are not following up, why the number of the lost to follow up cases is increasing. We have to find a reason behind why these people after coming and why they have stopped. So that is very important. So that's why we discussed, and I told them that in order to get the result, we need to put ourselves in their place. We need to find out what are the challenges faced by them. What are the things that we are doing that it is not giving the response we are expecting? Because we know that the stigma is very big. So that's why it's very important on that particular day I told them that our focus should not be only to those people who are infected, but to the uninfected people also. Because awareness is very important. It's so sad to hear. It's so sad to hear that children are being chased out from school, from giving education. If that is the scenario, who will come forward and test themselves and come forward for treatment? If we, as a population, if we don't accept them. So I feel that is very important. So I urge the people of the state to please, to work together, to unite. And because this is not possible if you are only expecting from Max or from the government. So we have to work hand in hand for this. Because a state is like a body. If one part is infected, then it's going to spread to the whole body. So that's why we have to work jointly. And like already mentioned by our Principal Secretary, the government is fully aware of this. And that's why we are coming up with a mission mode, a 5-year mission mode plan, where we'll be increasing the more number of the testing center, more number of the treatment center, that is the ART. And for this 5 years, we have also, apart from the support given from the National Aid Control Organization, the state of government will spend another 25 crore plus in order to see that more treatment center and more testing center will come up. And a part of that, there will be a more push on giving awareness. Because awareness is very important. And it's so sad to know that till now, there are so many people, they don't know that there is a treatment for HIV. Which is free, of course, very effective. If you come forward and get your treatment, then you can live a normal life, a dignified life, like a living testament like our president and his Mrs. standing here, 18 years. And when I look at him, he will live much longer. So this is a living testament that if you come forward, get yourself treated, you can live a normal life. So through this platform, I appeal to people living with HIV, please come forward. And from our side, I will assure you, we'll sit and definitely will discuss with the organization looking after this. We'll really love to hear from you because you know it better. We know there is quite a number of concern from your end. We'll really love to hear it, and we'll see and we'll try to help you in many ways. And we know that privacy is one of the concern right now. and that also will definitely look after it. We will be discussing with Max, so very soon we will coming up that to see that the privacy of the people living with HIV will be maintained, and they will get easy accessible treatment from the department. So the effort is still there, but like I said, it will never be possible if you are expecting only from the government or Max or from the organization, but we have to work it together in order to fight this dreaded disease, which is today, like all other have mentioned, and I also would like to again declare it that HIV is not a death sentence. There is a way of treatment and you can live a normal life. So with these few words, once again, I'm really thankful for the efforts and for the hard work of all the frontline workers from Max and other department. And I really wish to see that this issue is not addressed only in World AIDS Day only, but we should work it 365 days together in order to reach our expectation that we'll see that in coming 5 years that no more positive infected person will come from our state.
Memorial, CPO, representative from Voluntary Health Association Meghalaya, IDU. All the representatives, please will passing the program. Can we have somebody from Manba IDU? Can we have somebody from the National Institute of Paramedical Technology? People. And the